We're still trying to get out to the different areas and certainly build those relationships. We've had some wonderful, strong reports from both Republicans and Democrats in the Greensboro-Guilford County area. And hopefully at some point as our relationship grows, even when we differ on topics, you'll realize that there's a great conduit as far as being able to communicate back and forth. Some of you have visited our offices almost on a weekly basis, which is fine. Glad to have you. And speaking of our staff there, two of you introduced you. Julie Emmons was our district director. We also have Usman. Usman, raise your hand, helps in our office there. And we have Grace. She works in our DC office. Then we have Jerome and Janine. Luke, you guys raise your hand. They had a lot. And Rudy, guys, keep your hands up in case I need people to talk to, constituent work. In fact, the reason I point them out, it's wonderful to have two people in our office who are bilingual, helps in this area a lot, but also Jerome and Janine and others. We've been able to close over 700 veteran cases in the 2.5 years. It's something that's very important to me. My father having served and uncles in Vietnam, we want to make sure that we're taking care of people who have sacrificed and given so much. And we won't go list all the different things because I want to get to some of your questions. In DC, and the congressman, do you have a congressman at home? I'm still a dad and husband. In fact, you would think with all this burden of town halls, I wouldn't have had to walk the dog this morning, but the wife left, she's a family nurse practitioner, left me with that responsibility there. And 10-year-old, still dad, she's concerned about her reading EOGs today. So had a little time where we just kind of got together and prayed for her today, and we wouldn't be so stressful. But whatever the questions might be today, whether it's education, whether it's healthcare, whatever is on your mind, I've got a few more thoughts I want to share, but what I will do instead of taking some of your time, we'll weave those throughout some of the questions as we go forward. So without any other laboring delay, we will get started, and I guess we will draw the numbers out of that bag. Olga Perkins. Olga, did I just get past you when I introduce people?
It's okay.
Sorry, Olga works in our office as well, so go ahead, Olga.
Okay, so our first four numbers, listen carefully. I do have sort of a loud voice, so I'll try. 836 8964 836 8964.
And take what, for a rule, if you're on this side, you can go to this side. If you're sitting in this section, maybe you go to this side. And let's do 3 or 4 just to get in
right. Our second number is 836 8959. 836 8959.
We need a little Barker theme music or something.
Our third number, 836 8984. 836 8984. Number 4, 836 8985. 836 8985.
She have questions with you? Okay, all right. So, here it is. There's the 4. All right. Okay. So let's see. Zach, Ryan, which you want to start with? Zach, go ahead. Start.
Thank you for your time. My name is Beverly Bland. I'm from Pittsburgh. Because the American people and our nation have such pressing needs, with the infrastructure, and not just a choice of health care, but one that's truly affordable, so that 23 or more million people will be able to buy it, and especially to keep Social Security and Medicaid in place for the elderly and disabled and the working poor. Would you please not waste our money on a wall, but work to actually improve the things that I mentioned to make the lives of Americans better? Thank you.
Very good question. You hit about 3 or 4 things in there, so we'll kind of put them apart there a little bit. I don't think there's been any money designated for the wall, as we've worked a lot of time here, specifically on health care. Right now, there's a lot of energy on tax reform. We may get that to a little bit later on. But yes, what you said there, I couldn't agree more in the context of where these resources need to be going to. If you look back over the last few decades, without getting too technical here and keeping it moving, basically our budget now is about $3.7 trillion. And you have, it's in 2 columns. It has been over the last few decades, mandatory and discretionary. In the last 4 decades, what has happened, that mandatory discretionary has shifted. If you go back to some time ago, the mandatory was about 24%. Go back to late 60s, discretionary was 70-something percent. Why is that important? Well, discretionary is where education funding comes in. You mentioned infrastructure, military defense. What has happened, the spending has gotten so out of control in Washington that those statistical data have switched places. Now, we are closing in on 74-75%, tracking toward 80% mandatory, which is strictly only two things: entitlements and paying interest on the national debt. While education, defense, as well as infrastructure, disease research, those kinds of things continues to be suppressed. What I feel like part of my job is to try to find, where is that balance line? Where do those monies need to be divulged into? As far as specifically wall funding, this is something that if you go back only 5 or 6 years ago, that we had bipartisan support across the board as far as securing the border. That is something that I feel like is still important. Why is that, you say? Is because we have a lot of drugs that's run across the border. In fact, a lot of research that we've done, and this was a lot even as a former pastor, a lot of the human trafficking comes across the border there. You may disagree with that, but it's actually factual truth, that a lot of these, in fact, the way that it breaks down is that you have a lot of coyotes who actually, when the families don't pay or can pay, they actually take some of the children from these, and that's pretty much documented. In fact, 23,000 people were murdered in Mexico last year, only behind Syria, when it comes to some of the drug trafficking, some of the cartels that exist there. That is a fact. So, to say where our priorities should be, that's part of the debate as far as where that money should go. Because sometimes I think the way people view a Republican, I guess, is that there's this great big pile of money behind us, and these misers Republicans kind of independently say, well, you get some, and you get some, and you get some. The challenge is this, and just being as transparent as possible here, when you're running at a $700 to $800 billion deficit year after year, the debt's gone up from 11 trillion to 19 trillion in the last 7 or 8 years, without trying to exaggerate any of that. There is a part of it that says, is it part of my responsibility to somehow maintain these spending controls or put some caps on things as we move forward? We'll get into more detail, but I would agree, at least this part, if we can find a place that the wall isn't number one priority, but it's securing the border, I believe, is a priority as far as we move forward. So, okay, question to say.
Are you saying that the wall is a priority?
Yes.
To you?
Ooh.
Well, I believe it's a priority to many different people, yes. Listen, Nick, I want to give her a chance to ask her question. I hear the open borders, I hear that, but let's let the lady ask her question, then you can re-engage again, okay?
I care deeply about keeping my country safe, but I don't think that the plans Donald Trump has for his border wall and deportation force will increase our security or safety. Not only will they make us any safer, but funding immigration enforcement will prevent us from paying more important programs like education, housing, Meals on Wheels. Can you commit to me, your constituent, that you will oppose any request from the White House to fund the wall and a mass deportation regime? And wait, I want to say one thing. Tomorrow in Greensboro, there's a press conference because there's a woman who's about to be deported, and she's going into sanctuary in a church. And Senator Tillis will be there to speak.
Okay. All right, thank you for that information. You asked two parts in the one question there, as far as the funding of the wall, and then as far as deportation. As I said earlier, I think I answered the first part of the question as far as how I feel about the wall. When it comes to deportation, I know that's kind of an area where they say, okay, don't venture into the immigration because that's a tough. I'll tell you how I feel on it. No, I'm not for mass deportation. I don't think that's. I don't think that's. Maybe that's as a minister for 2 decades and working in refugee camps over the years in the inner cities and places like Cleveland, New York, and Baltimore. I am a Republican, but I hope from a compassionate standpoint, my faith requires me to see people in a different light. Now, at the same time, we have different laws that are on the books that it's our job to follow through with. And if the laws need to be changed, and that's how we work through the legislative process. But I believe at least one place that we can agree on this is that there are over 40,000, not just charged, but convicted felons, who have, are illegals. I would be for deporting those folks, those who bring in and have harmed our communities, whether in a sanctuary city or not. I feel like those should be at the top of the list, certainly for deportation, and I hope at least that would make sense, I think, to some of us anyway. Okay, thank you very much. Back over here. Good question, though. Thank you.
This is my daughter Jackie. She's 12 years old, straight A student, but she's missed a lot of school this year, and I mean a lot, because she has had migraines. We have battled with the insurance, Federal Blue Cross Blue Shield. They have denied medications for her for days to weeks. So here she is suffering with a migraine, can't go to school, and the insurance just says, well, we need X amount of days to review this. They deny medication, they don't say, but we'll cover this instead. And also she's had polyps in her sinuses and had to get sinus surgery. The doctor recommended a sinus surgery. It's been over a month now, going back and forth with them. They said, oh, you sent it to the wrong fax number, and disagreeing with the doctor. Well, I asked to see the doctor that overrode our doctor at the insurance company. Guess what that doctor is? This is regarding sinus surgery. And she goes to a pediatrician for her migraines, a pediatric neurologist. Because in North Carolina, there is a law that only a pediatric neurologist can give migraine meds. So it was an OBGYN. Who is not even a practicing at a hospital affiliation. And I was told, well, we're just following procedure, or we're doing what the FDA says. I said, give it to me in writing. Nobody's giving me anything in writing. I said, you are caught. If I would not give my child medicine, you would have me under the law for child abuse. If I don't send my daughter to school, you would have the truancy court on me. I have called her teachers, talked to principal, and everything, but luckily she is a smart kid and still gets straight A's. But if she goes to 8th grade, she is only allowed to miss so many classes, and then the courses will not count. So if this goes on until she's in 8th grade, you are punishing a straight A child. And I want to know, North Carolina Blue Cross Blue Shield pays for the surgery. They don't consider it investigational, and Medicaid, also per my ENT, will pay for the surgery, but Federal Blue Cross Blue Shield denies it as it's investigational. So you tell me what I need to do.
Sure. Well, first of all, let me say, Jackie has a very strong mom who's willing to fight on her behalf. Not everybody has that. As far as specific policy under the Blue Cross Blue Shield insurance on the federal side, I am not that familiar with how they review each and every case. I can promise you that we will get your information and be able to follow up with you. But as far as speaking on behalf of the insurance company, it's a little challenging for me to do without knowing all their policies. I'm sure we'll talk some about pre-existing conditions and some things today in getting into that to making sure that people are protected. But as far as knowing all their policies when it moves from the state to the federal, as far as what they're required to do or not, I'm just not that versed in the insurance company. Go ahead and follow back up if you had something. So put the mic back to you.
Yeah. The insurance, what's equally frustrating is the insurance, when I asked them, I said, well, if you won't pay for this sinus surgery, if you want something more invasive or whatever, please tell me what you want. Then what kind of surgery you will do, or what kind of medicine you will prescribe, so she could get the medicine that day. She doesn't have to wait days to weeks with a migraine in the schools. And they tell me, well, we're not doctors, we can't do that.
Is this a local representative of the insurance company? Or
I have talked to the DC headquarters, I have talked to the 1-800 numbers. Every time, part of the problem is we get a different representative to do this. And I've even been told it is covered. And there's another thing you need to look into. There is a pre-existing, a pre-certification and a predetermination. And most people do not know what that means. Pre-certification means If you have a hospital stay, that they will say, we agree and we'll pay for it. And then they told me, you don't need pre-certification for the sinus surgery, so I'm calling around, and your doctor just needs to say it's a valid surgery, and I did that, and they sent documents in, and then they said, oh no, you need a predetermination, which means whether we'll cover it or not, pay for it or not. So there's a difference between saying you need a pre-certification, which was what they're telling me, and then the representatives didn't even know the difference between pre-certification and predetermination and their customer service.
All right, I appreciate you bringing this to a light. Do you live in either Chatham or Lee County?
I live in Sanford.
And so, okay, so because we're, if you're in another county, we would have to refer you to another member, just that's the way the federal. We can't influence the private sector, obviously, but what we can do is call and get some additional information, because we certainly don't want you to continue with the struggle that you have there. I'm sorry for how much trouble that you have been through, but before you leave, if you'll give us your name and number, we'll be able to contact you and kind of see where that goes and what we can do to help. Can't promise anything because obviously being a private sector industry, but we'll do what we can for you, okay? Is that okay? All right, thank you so much for being here today. Okay.
Get the insurance companies out of the way.
Thank you for being here. Sure. First of all, my question, I'm not really prepared for the question because I don't think my number would be called.
Okay.
However, I would really like you to explain to everybody here why you decided to vote for the ACHH.
Yeah. AHC, yeah, American Health.
And give us at least 3 reasons, because it doesn't seem to be doing better than Obamacare or the ACA, but maybe it will be. But why would you vote for a bill that I don't know if you read it or not, but most people didn't.
Over 70 pages.
And I'd really like to know why you personally voted for that, and what made you make that decision.
Incredibly fair question.
Okay, I have another part.
All right, go ahead.
Question.
I'll try to remember all
And
of
why are you holding town halls at 2 o'clock in the afternoon?
The first part of the question, in fact, let me start with the second part of the question. We've had, in the 2.5 years we've been in office, we've had 25, 26 town halls, maybe more than that. And not all of them have been during the day, but when we're back home, give you an example, our Washington schedule, in fact, we'll be going back next Monday, we will be in DC 8 of the next 9 weeks. I do get in on a Friday evening, fly back out on Monday morning. So we have a limited time in the district. So what we're trying to do is making sure that we pack them in, because we have 8 full-time staff people working here. And by the time I get back, the amount of constituent appointments that we have is pretty full. So what we're trying to do is get as many in as we can before we go back to Washington DC. We do have an evening one tonight, but just this time it happens to be over in the Asheboro-Randolph County area. Try to have an early one. We made a promise that we would be accessible to the people that we represent. And even though these 3 counties are fairly new and people are still trying to figure out the amount of these crazy Republicans or what, and that's fair, but we will continue to do this, but we can't always do just one after every evening, because there are many other events that we're asked to attend, from Eagle Scouts pinnings, to meeting with different veterans events, nonprofit, all those different things that we do fill up our calendar even in the evening. Now, the first part of the question, can I just follow up, push back, okay?
The reason, because if you have it in the afternoon, it limits who can attend. I mean, there's a lot of families that live in this area, and the people work during the day. I have a flexible schedule. And that's the only reason, if you're gonna have a town hall, do it when people can attend. That's all I would ask.
True.
And I know you're trying to fit them in, but.
No, that's fair,
Okay.
that's fair. Listen, the reason, and I won't come across it, the 4 counties that we're in today, we won by 64 or 65% last November, but it's still important to try to be visible to answer all these questions, because we know that we don't just represent people who vote for us, we represent people, all different political parties and communities, so we're gonna say, hey, you get a question, that's fair. So transition from there to getting to your first question there is basically, why would I support the AHCA? Can you give me 2 to 3 reasons why you support the AHCA? Have 3 reasons. Okay, all right. Okay, all right. So here we go. All right. Number 1, let me give you a little bit of background. in 1913, the House of Representatives went from 394 to 435. Okay? Not since that time until the last two cycles of Congress have ever 240 Republicans been elected in back-to-back Congresses. Never happened before. We've got some different spikes, but nowhere 240 back-to-back. 99.9% of those Republicans ran on one primary thing, and that was to repeal the ACA, repeal Obamacare. Why? Because their constituents had reached a place where they were demanding of their representatives to go and you may disagree with that, but that was what, let me just speak for myself. That is something that we made very clear in making 10 different promises that when we stepped away from the ministry 3 years ago, we resigned at our church, ran for the full year in 2014, and what we ran on the most was the fact of the overbearing overreach of what is known as the ACA or Obamacare. Now let me get to the more specific portions of your question there. The first reason that I felt like was important is because of the way the premiums have skyrocketed over the last 8 years for people in the individual market. Now remember, that you read a lot of stuff and you hear a lot of things. We're talking about 7 to 8% of the people that have insurance are in the individual market. 175 million are people who have employer-based plans. Okay, that's who this, whether it's Obamacare or the AHCA, that's where this big discussion. Important group of people. There's no question about it. Number two, when the original bill was passed with 25 or 2,600 pages. It was kind of to be the end all, but here's where, and I'm not going to say that whether it was President Obama or whether it was the Democrats even intentionally missed this. I disagree, I haven't made my point yet, okay? Good anticipation though, right? Is that they expected the younger people to sign up in ways that they chose not to. So therefore, it has created, in the $1.8 trillion of debt that it is adding, it has created a problem because the mandate, which was forcing the younger people to buy insurance, they chose to pay, many of them chose to pay the tax and fine instead. So far, so good? Pretty much, yeah. No?
You raise the figure.
So what happened then is that now you have added, we've added, mostly by Democrats, have added several thousand pages more to try and fix the ACA. And even though we're going to disagree on this, is that we felt like that long term, according to the numbers that we have, the ACA is not the solution for health care options when it comes to people in our country. And the data says this.
Single payer.
I know, single payer, I've heard that a couple times. I've been asked about that a few times, and let me interject that. Not even Debbie Wasserman Schultz or Nancy Pelosi supports a single payer. So on their particular bill, I'm not saying that those people represent all of you. Well, the thing about it is that members of Congress that are being sent do not support the single payer. Now you may, and I understand why you want to do that, but it's not just Republicans who don't. My point is that many, dozens and dozens of Democrats in the United States Congress do not support a single payer.
But that's what American people want.
Well, if it was the American people wanted that, they would elect a majority of the people who represent them on the single payer.
And they will next time.
Gerrymandering, okay. So, well, let me answer gerrymandering, okay? Okay.
Where is Jerry?
If you want, and I'll come back to it. We're getting a little bit outside the boundaries here, but I'll address gerrymandering. Happy to do it.
Yeah, we know that. So what?
Well, if you wanted to say the reason why there's 1,000 new Republicans that have been elected from the federal to the state to even the municipalities over the last 5 or 6 years, that's a fact. You heard my number about 240, but if it is truly gerrymandering, how would you answer this question? In 2010, there were 27 Democrat governors. There are now 16.
Gerrymandering.
You can't gerrymander states, can you? No, I didn't. I'm not trying to be a smart butt on this stuff, but the numbers just don't support the argument that the American people are demanding what you're doing when you cut half the Democrat governors throughout the country from 27 to 16 during this window of Obamacare. Now, getting back
North Carolina is leading the way.
Getting back to the question. and as far as some of the reasons. One is because we felt like in creating this, in fact, the first rendering, I guess you could say, we were against on this first AHCA. Some of you pay attention because I can see a lot of your comments on our Facebook page as far as what's going on. But the first thing, we did not support it. The second one, we did get behind, and in fact, we worked some with the White House on it. One of those things is to create the high-risk sharing pools for people who have pre-existing conditions. So that's one reason, okay? Number two is because of not just the promise component, but if you look at how many people are having reduced options or choices when they're healthcare providers. North Carolina is down to one option. Tennessee and Iowa, by the end of the year, they won't have any insurance companies. They'll still have Obamacare.
Why?
But what good is Obamacare if you have, first of all, a $10,000 to $12,000 deductible, or if you don't have any providers that are even in your area? That's number two. Number three was the absorbent cost, long-term. The AHCA repeals $980 billion with a B,
For
taxes. Taxes cut across the board for everybody.
No! There are numerous sources to back that up. That is just outright untrue.
When you, on Obamacare, when you strip away out all the $1 trillion, I will succeed to you, or succeed as far as the bulk of that, Obamacare taxes was put on the wealthy. So when you pull all those Obamacare mandate taxes out, then
still back on.
yes, by proxy of portion, then yes, then you are taking more taxes off the people who are paying more taxes. But I agree with President Bill Clinton when he said this model doesn't work here. I also agree with the Minnesota Democrat governor who says Obamacare has killed small businesses in his state. These aren't Republicans. These are Democrats who have a concern with this. So there's three reasons. I may get into a few more as we move forward. So thank you very much for the question. Zach, do you have somebody else?
Our next four numbers, listen carefully, 836-9002, 836-9002. Number two, 836-9018, 836-9018. Number three, 836-9021, 836-9021. And number four, 836-9014, 836-9014.
Yes, sir.
Thank you for coming today. I think we should continue talking about healthcare because it's 1/6 of the economy.
Yes.
It also affects all of us, and it affects our hospitals throughout the state, which are going to be in trouble, particularly because of the ACHA. I have a few different questions about this. Why did you vote for this bill before the CBO? It was a major criticism of Republicans before the ACA was pulled out, and a CBO estimate was provided.
Sure.
Second of all, you say premiums have gone up. I've actually been on the websites, gone on the Obamacare websites for this state, and the numbers you're talking about don't really bear out. But it seems to me like this program worked in Massachusetts when Governor Romney passed it, and the Heritage Foundation, the framework of this came out of the Heritage Foundation. Of the ACA, with the conservative plan. Now, my concern is, why don't we increase the pool, increase the penalties, and have people take responsibility for getting their own healthcare, so we can make healthcare affordable for everyone.
Yes.
Excellent question, Brian. Yes, very good. I'll try to go through them. If I miss one, stay there and we'll follow back up with. I think let's first start off with the CBO score. The reason why is because we felt like the crux of the bill in the original CBO score would be slightly altered one way or the other. So it wasn't like it was a brand new scoring system as opposed to scoring the amendments that were added to them. And which played out because it went from 24 million to 23 million as far as premium insurance. I'm not bragging about the number, but let me explain a little bit number from our perspective there. Anytime that you have government forcing you to do something, and I'm one that likes to keep as much government as my life as possible, but for those who are of a different persuasive thought, let me say this, for what happens, part of that number, and 2 points I want to make on that. Number one, part of that number is when you lift the federal mandate and you're not forcing people to get insurance. Yes, if you project a number out there in 10 years from now, I can understand why they may come up with that number. There might be a lot of younger people that want to put their money somewhere else as far as forced to buy insurance. That to me, that's a freedom that they should be allowed to make, as opposed to saying, no, we are demanding that you're going to buy this into this government program. Okay, number two, as we have already seen in the past, is that the CBO doesn't always get it right. They didn't get it right with the bond.
No. That's a cop-out.
The actual numbers, and I know you can say, hey, some of those were driven to Medicaid, which I would be a proponent. That's probably not the best healthcare or insurance that you can have. But a lot of those folks that they predicted to have insurance simply didn't do it by about 12 million. So the CBO, not poo-pooing on those guys as an organization. I think they're taking an honest approach at it. But from a track record, they've not always been right. The second part of your question had to deal with, remind me specifically the second part of it. Make sure
more to it. You think about freedom of choice. What about my freedom of not having to pay for someone who chooses not to have health care? That increases my freedom.
So, I guess you're saying you're making a case between premiums and Medicaid, because right now, it is, listen, that I agree with you probably more than anything else when it comes to personal responsibility. But by adding another entitlement program, which is $1.8 trillion, I think you said 1/5 or 1/6 of the economy, personal responsibility means you have a little skin in the game. Now, many of you have children, many of you have people. If everything is given along the way, what you want to do is try to find some kind of punishment. Now, what I mean by that is up to 70 million people who are on Medicaid currently, about 8 million, 9 million of those are able-bodied adults with no kind of physical condition. My goal or my job is to allow states to have some kind of optional work requirement, that for people who really want to get out there and pull themselves out of poverty, there's some kind of timeline. We have seen some success both in Maine, in Kansas, as well as Georgia. So, and your final question there. Was there any other thing you were talking? I think you had a three-part. Is that it? Okay, all right. If there is anything else, come back up there. We'll get it. Yes, of course, you're welcome. Over here. Yes, sir.
My name is Commander Mike Stanford, United States Navy, retired. I am very concerned about the complete breakdown of controls of our secure information in this country, including the DNC leaks that occurred through the theft of their computers and the Homeland Security Committee. 30 Democrats, their equipment was stolen. That information is now in the hands of our enemies. This is something that should have very, very high consequences. I know in my security times, if I had done the breaches that I'm seeing now, both in the government, I would be in Leavenworth for the rest of my life. We have got to control this leaking problem to maintain the security of the United States.
Thank you, Colonel. Thank you for your service. The question there. I'll do a quick response to that. Yes. When we have classified hearings, there's a reason why that we don't bring our phones into these SCIFs, that we want to make sure, and not trying to use a political talking point, even Secretary Clinton knew the risk when it comes to establishing a private server with classified information on it.
Pence? Yeah, Pence had one. Yeah, you're gonna lose on this one, Mark.
Our president doesn't seem to know the risk.
Yeah, that's true. Quick.
It's okay. I'm not justifying anybody who's willing to put young men and women in I'm not willing to put any young men and women. I've seen these folks in the mountains of Japan, studying satellite, 12 or 13 young people at a time. We don't want to expose those folks, whether it's Democrats or Republicans, whether it's Secretary Clinton or whether it's Donald Trump. We want to make sure. Here, listen, the Russians are not our friends. Okay? Listen, Putin is a key former KGB officer. And that's why Mitt Romney was 100% correct when he told Barack Obama in the 2012 debates that Russia is our geopolitical threat. The president made fun of him for thinking so, but I think Mitt Romney was right there. So, but next question. Over here on this side, is that?
Yes, what about Obama?
I am a first-generation American. I was born in New York. And as you can all tell, my father was Swedish. Thank you. When I hear you speak about spending all this money on a wall, it hurts so many of us because we all have friends, we have family, we have co-workers, our fellow Americans. We all came from somewhere. And we come together united as Americans. We work together every day. The average American makes less than $30,000 a year. And yet you would have us paying such a disproportionate amount of our money, which generates jobs, which stimulates the economy, that you would have us spend it on building a wall to keep people out. When my mother and father came to this country, one in 1947, one in 1953, they had to have sponsors. They had, if they were not checking in, having their green card renewed, and they didn't have to pay $900 a year, although I believe it's all that fee has also gone up.
It's creating jobs.
But what they did was came here because they did not believe in the socialism of Northern Europe. They wanted to come and try as an individual to further their dreams. And only 40% of our illegal immigrants cross that, excuse my French, damn border. Most come in from overstaying a visa, from overstaying a student visa. Why aren't we asking the universities to take responsibility and be tracking these people? So this is just one point. What I want to know is, how can we Americans reach you up there at the top? We are tired of being trickled down. We are tired of being talked down to. And quite frankly, we're embarrassed by the way Congress acts. How can we trickle up to you some very good ideas and help you make this America what it used to be?
Sure, yeah, that part I agree with 100%. In responding to, and thank you for, I can tell this is very, very passionate from your heart there. In responding and talking about the immigration part, specifically the wall part, I have a question just by showing your cards there. If securing the border costs no American people a single dollar, how many of you would still not be in favor of it? In other words,
Is Mexico paying for it?
no, I'm not suggesting that. If securing the border costs the American people nothing, would you still believe that we should secure the border? Fair question. Is that, the question is simply this: in securing the border, I don't know that there are places where a wall is best as far as gun cross. I think with our technology approach there, I think there are places that from surveillance, from other things that we can do, it's about securing the border, not necessarily about building the wall. But I will tell you this: in serving the first 2 years on Homeland Security, if you think there are people, and you're right, now about 40% correct coming across the border, but if you do not think that we have people who despise this country and have for decades that are trying to infiltrate, right now, the FBI, the independent organization, have over 1,000 active investigations right now of radical Islamic terrorism in our country. That's over 1,000 FBI investigations. Those are active. There are some of those as well. Let me finish. However, it's not what we've seen with ISIS connected now with Boko Haram, with Al Qaeda. These people want us dead. So therefore, securing the border. I was in a Syrian refugee camp last year, and before that, I did ministry work in different refugee camps throughout Europe. Okay, so in that Syrian refugee camp, it's interesting because through a translator, I talked to a couple families. And in their mind, bless their heart, they think America, all we have to do is tell Assad to knock it off and it's okay. But I will also tell you this. In meeting with the Prime Minister of Defense of Jordan, he said, this is our biggest concern. He said, they're up to about 1 million refugees that are coming in. He said, our concern is that we have no way to vet the people coming in, whether they're part of the army, part of the revolution, or if they're private citizens, because they have no documents with them. Now, I think recently they just doubled from 25 or 50,000 as far as bringing people into the country. All of us, most of us can trace our roots back to being an immigrant. I get that. That's one of the great things that has made this country so wonderfully diverse, is because of that. However, to say that we should ignore whoever wants to but that's why I was asking this: is it against the wall or is it against securing the border?
The wall.
All right. So there is some agreement that we should have some right to secure the border. Okay, that's. I hope you can answer the question.
Yeah, but there's more people getting killed by stupid gunmen with guns than the people coming in forward.
Okay. All right. Next question. I think on this side.
Hi, you were talking about people lifting themselves out of poverty.
Yes, ma'am.
Okay. How do you do that? Working at McDonald's.
Yes.
Yeah. And do you support a decent minimum wage?
Yeah.
Fair question. Here's what I support, and this is based on years as far as working in the different communities. From a former pastor mindset, if I could put that hat back on, here's what I've seen, is that a lot of these systemic issues that we face in our society is the breakdown of the family. Many of our children, there's no models, that they go to school hungry. They're basically trying to survive. Here's the data. In the 1960s, the family was intact 80% of the time. In many of our communities now, it's less than 20%. That's a fact. You can look it up, okay? Now, now to get to specific to the question, I'll try to keep explaining. The point is this: is that part of is higher wages. Yes, it is part of it, but part of it is, as a person of faith, I believe that every person, every boy and girl is created with incredible uniqueness, with talents, with skills, and with abilities. And what I fear sometimes is that when we go overboard, or when we create a spirit of entitlement, I've made mistakes with my own kids. When I
People enough.
Nutritional food is not an entitlement, right? Exactly.
One entitlement.
Thank you. Yes, as far as, I met with the superintendents, Guilford County, they have 67% of their kids that are malnourished, okay, or undernourished, I should say. It is an issue, and if you can't meet the basic.
How they got this,
Is if you do not meet the basic needs, yes, it puts children, it puts others in a very bad spot. And just because when I use the word entitlement by definition, that's not a knock for people. Listen, my younger brother's blind, okay? He's been blind for 2 decades. He's got 5 children. He will never walk them down the aisle or see them play baseball or what have you there. Now, I understand that people have hardships in life, okay? And there are, you don't believe they have hardships?
Can you please define what you refer to as entitlement?
Let me finish the thought, and I will explain what I was talking about. Just because that you're on a federal funded program, officially in a budget item, it is an entitlement. It doesn't mean that you're a bad person, as I was just mentioning my brother, because of that. But if you go back and look at that 80% that we're climbing toward, whether you want to call it Medicaid, Medicare, the different SNAP programs, all these things, that is some kind of government program by definition. I am not breaking down or hating on people who are part of that. My mom and dad, my dad's been a small town minister. They're in their 70s. Mom raised 3 boys and volunteered at their church and school, never had a job. I know how meager their Social Security is. We're not looking to try to do damage to those things. What we are trying to do, as far as saying, how do we get the massive out of control spending that has been skyrocketing for the last several decades? And if you want to talk about poverty, you look at how many, not just millions and billions, but how many trillions that we have spent on poverty, and we've not seen a great reduction in it. So what my point is there a cultural component? I'm not saying stripping away all of the funding, but is that by itself enough to resolve some of the issues that we're facing in our society? I'm making a point that I don't believe it is. Yes, yeah, well, a couple of them interrupted you and asked me about some other things. I was trying to cover things through. Hang on, let me get back to her question, okay? Let me get back to her question. As far as minimum wage, I am not a proponent of putting some kind of standard out there. The reason why is because in talking with small business owners, I've got a friend that runs a yogurt shop there in Greensboro, almost there in Summerfield, North Carolina. If he was forced to pay, what do you think a number? Pick a number. 15? 17? 18? 15, 18, 17, okay, all right. If you come in, his 4 employees would probably go to 2, maybe 3. He would not be able to sustain and be able to make a very small margin of profit as he's trying to do his small business. So sometimes in theory, it sounds good, but if we put that's another one of what I feel like with those mandates in the small business there. So, all right, so that's why I'm not, next question.
Okay, we have time for 2 more questions. 836-8981 and 836-9015.
Huh? I'm 911.
Yes, sir.
I'm extremely disappointed about what Republicans do together what we refer to as Trump care. Republicans ran Trump care through Congress in less than 24 hours without giving members enough time to even review the final bill or fully consider its implications. Some members even admitted they didn't read Trump care before voting for it. It received no hearings. The flawed process used to pass Trump care in the House is undemocratic and unethical. As your constituent, I want to know why you voted for a bill that did not follow a transparent process. Do you think this process is the best thing for the American people, and this is the way Congress should work? Yes or no?
No, I agree with your point. It should be rushed past American people. It's one of the reasons that I voted no in January, because I felt like it was rolled out in an improper way. The first part of your question is for us altogether. The basic framework actually was 1.5 years ago with a program that came from Speak Around called Better Way. All these components that you're seeing in healthcare, there were some tweaks in it. When it first rolled out, I voted against or pushed back against it, went on record publicly to say I wasn't for it for several reasons. One of them was the lack of transparency that was rolled out. But as far as vetting, it did go through a committee through the process there. But this was the major framework or structure that started year and a half to 2 years ago. There was also another plan that was introduced and did not receive a majority, that was more of a tax or a deductional-based insurance plan as opposed to what we see now. But it wasn't, I know we hear that sometimes, that it was thrown together, but this has been something that's been working over the last year and a half. But it is a fair question. Anytime that something is rolled out that is kind of behind the scenes, I've voted against that before. I'm gonna vote no against it like I did with this one when it was kind of squeezed in there. Even though we knew the basic groundwork of what a better way was by the Speaker of the Leadership Office, I still didn't think, I thought we could do a better job as far as making sure that the American people knew exactly what was in it. So, thank you.
Well, my
Yeah, sure.
follow-up is, why weren't there hearings? Because you didn't really reach out to the stakeholders of the insurance industry. This is what's going to work without the experience.
Yeah, the research they've been gathering for the last year and a half, they have. In fact, in some cases, we've even been accused that the insurance people actually wrote the bill. So yeah, if you allow me to push back a little bit, in theory, that is not the case. There have been multiple people that have inputted on this bill, not just insurance companies, but others as well. In fact, even I believe it's Blue Cross and Blue Shield recently made some comments about it. But there's, I'm trying to remember the exact specific quote they put on it. But nevertheless, it was not just politicians, if you will, in a room crafting this bill. There was other input sought and received the last year and a half. So, okay. All right, next question. Yes, ma'am?
What is your position on sanctuary cities?
I don't believe that sanctuary cities should be harboring people who have broken the law.
Breaking the law. There's breaking the law and then
there's breaking the law. That'll be the best answer I've heard. So,
just as background. I live in Arizona, when we were going to school. And we had problems with the boys, we had the coyotes, they're always talking about it. It seemed that the people that were brought across that got the most publicity were the people that were the workers. The criminals, they always got in. They got loaded on boats and dropped off in LA with fanfare, they came in tunnels, everybody knew about it. The people coming from Colombia, the other people coming from Russia, from Syria, all those people, they get in here if they're a criminal. But if they're a person that is a worker or they're doing something to further their family, they're the ones that seem to get picked up.
well,
So,
and that's,
I have.
and that's, you know, that's why I had said earlier, if that, we would at least agree that the 40,000 who are convicted felons, that we should remove those folks, concentrate on those people. But listen, I don't
What
want my
guarantee
chief.
do we have that they'll not come back?
I'm sorry?
What guarantee do you have that they won't come back? They come in and then.
That's why we want to secure the border. Yes, thank you for that question. So yes, that's why it's important to make sure that border is secured. It gives us some more protection by the border agents there. Let me wrap up with this if I could, please. First of all, thank you for taking time out of your day. To the lady's point, as far as in the middle of the day, I know that's tough on some folks there. I hope that we've gotten to a few of your questions. Know that we have office hours here in Sanford, remote office hours. We have people that come in and making sure where you're not having to drive to Greensboro or other headquarters there in Graham. Want to be accessible there. So I didn't hear that, ma'am. What was it? Yeah, we did our first one in Chatham County. I know a lot of you folks from Chatham County. So we I'm sorry? No, never mind. Okay, all right, okay. The point is this. We know it's a little bit of a journey sometimes to try to come out or drive over. We're trying to be accessible as we move forward. We'll have people here in the district. I'm not under any kind of premonition that we're going to agree sometimes on very much at all, if anything. But we will continue to try to connect with you folks to at least hear you out. Now, that's our job. As representatives, we made a promise that we would be accessible. We understand that. That's exactly right. And whether it was 2 decades as a pastor and serving in the local areas that I did, or now serving as a I know that really bothers you when I bring that up. But that's, will always be part of my life.
Considering the
And-
lies you put out, it does bother us, yes.
I'm sorry?
Considering the lies you put out in your letter about the medical situation,
Okay.
you're citing our passion, it does bother us.
Okay.
Cutting out 24 million people in a fast
Okay,
rate.
I think we addressed
Thank
this.
you all for coming today.
I know, I'm gonna give you, hang on one second, we're gonna extend it one more.
Very sorry, could you just see a show of hands, people in here would like a one-payer health system?
There you go.
You represent us.
There you go. I represent you and the 62% of the people who voted for me too, so I represent both of you.
Thank you all for coming today. We do appreciate your presence and your participation. We ask that you do exit through that door right there that says exit.